Hey guys, Kim here, and you are tuned back into my YouTube channel, Kim E, the Diabetes NP, a place where nurse practitioners can improve their diabetes management and education skills. Today we're going to keep it moving, keep on going through these drug classes. We're going to talk about, brace yourself, sodium glucose cotransporter 2 inhibitors. We also know this drug class as the SGLT2 inhibitors. This class carries your Jardiance, your Farxiga, your Invokana. So it's a really good class. I'm actually interested. I'm interested on all the classes, but this is one of those drug classes that I think I kind of like this drug class. So let's get right on into it. Okay guys, let's go ahead and get into the overview. Now moving forward through this video, I'm not going to say the big long name, I'm just going to say the initials, SGLT2. And even that is kind of a mouthful, but it's better than the long name. So, so let's get right on into it. You know, I always like to go over a little bit of mechanism of action, and clearly by the name, we know that this drug class is an inhibitor. It inhibits something. It inhibits the SGLT2 transport system. So let me explain. About 90% of the glucose in our body is reabsorbed by the SGLT2. Okay, now why do we need to know this, and why does a drug class need to inhibit this? We don't want that glucose to be reabsorbed back into our system. We want that glucose to get out of our system when we're dealing with a diabetic patient. And that is simply what that drug class does. It inhibits that transport system that reabsorbs that glucose back into the proximal tubule of the kidneys, okay? So because this drug class inhibits that action of that transport system, it in turn increases the glucose excretion through the urine. Now it makes sense because we're dealing with the kidneys, right? So with that, you're going to see high amounts of glucose in the urine because that's how it filters this glucose out of our body. So something to really keep in mind, I guess like a pop, is that when you're doing the simple urine screening, the dipstick, you're going to have a positive test because, simply put, the glucose is going to be in the urine. We're going to expect that. So you're going to have to get blood tests on this patient to really see about the glycemic control. You almost basically need to not even look at the urine because we're expecting glucose to be in the urine. You're going to need to get a blood test. Now this drug class is very effective. It really lowers the A1C up to 1%. So if you have a person that is at an 8, at the most, it can bring that person down to a 7. If somebody's at a 7, it'll bring them down to a 6. So it's a good effective medicine, but the drawback is that it's expensive. Let's talk a little side effects, okay? Now the thing that's very interesting about this drug class, at least in my mind and how my mind works, is that once I nailed down how this drug works, the side effects, the precautions, the contraindications, they really made sense to me. I was thinking to myself, that makes sense. I can see how that's going to happen, and I actually could work myself through, the side effects, and there's not a lot that just comes from like left field or whatever. So the big thing that you need to be aware of with this medication, because there's a high amount of glucose in the urine, we have to be on alert for urinary tract infections and also yeast infections. And this is a good POW that we can educate our patients on, is that if they're starting to have symptoms of dysuria, difficulty urinating, we need to let them know that this medication can definitely cause these types of infections, okay? Now, something else to consider, because this medicine works on the kidneys, you are going to have more urination, polyuria, okay? And if you pair that, especially if you pair that with the diuretic, this person is going to be having a high amount of output. We have to be aware of hypotension because of the decreased volume, all right? And one last thing to consider specifically with the drug Invokana, is that a person can develop hyperkalemia. Okay, so we want to be monitoring those potassium levels as well. All right, precautions and contraindications. And you're going to see, just like with the side effects, this stuff makes sense, okay? As I'm mentioning some of these things, you're going to say, you know what, Kim, I could have anticipated that. It actually makes sense. Okay, so you probably have noticed that there's a common theme with all these drug classes that we've been going through. You're not going to be using this in a type 1. You're not going to be using this in a DKA patient. And because this medicine works at the kidney level, this is how it works. You're not going to use this in a patient that has severe kidney disease, okay? They need to have a little bit of kidney function, a good kidney function, for this medicine to work, okay? So another thing to keep in mind too is that this drug class can actually increase your LDL cholesterol. So already we're knowing that we're going to need to monitor our cholesterol, monitor our potassium, because we know that with one of the drugs in this class, it can increase potassium levels. And then we're also going to need to monitor our kidney function. And one last thing as well, with the drug Invokana, you will not use this medicine for a person who is on dialysis. So those are your precautions, contraindications that we'll commonly need to keep in mind. All right, so just to wrap it up, I do want to summarize the POW, the Pearl of Wisdom for your patient. These are the things that you're going to need to educate your patients on. For one, you need to let them know that they're probably going to have increased urination. They're going to have some polyuria. We also want to keep in mind that we need to let them know that this drug class may cause a UTI, may cause a yeast infection as well. And we need to also educate over the signs and the symptoms of ketoacidosis. That's your nausea and vomiting, abdominal pain, confusion. We want to let them know what these signs and symptoms are so they can communicate this back to us. All right, guys, that's all I got for you. I hope you like this drug class. I kind of like the drug class. I don't know, it's something about it. It's very effective, though it's expensive, but I like it. And I've seen good results in patients as well. And so, you know, it gets your patient to goal, so I kind of like it. Don't know. Anywho, do me a favor if you have not already. Subscribe if you have not. Ding the notification bell as well so you don't miss an upload. And share this video, share this channel with anyone that you think that may get any use out of it. Also, in the description box, I have gone ahead and I have linked the medication cheat sheet for this class in the description box. So all you have to do, click it, print it. You can download it on your phone or any mobile device and you'll have it there at your fingertips. Again, you have been sitting here with me, Kim E, the Diabetes NP, and I'll catch you at the next video. Bye.